From an estate's perspective, the initial response to the pandemic in the very first few days was actually getting supplies. So, and there are contingencies for things like food with our major contractors, but we were actually concerned about the fact that even just the DIY shops closed. So our major suppliers also closed, which was a real shock for us. So the very initial couple of days where it became really acutely obvious there was going to be quite a dramatic incident to deal with, we did our utmost to get as many supplies bulk bought as we could so that we had them in stock. I think after that came the realisation, working with the clinical teams, that due to the nature of COVID and actually the fact that we didn't really understand fully how people were contracting it, we needed to try and segregate our patients. So this is where we went to a system where we had different pathways for patients who we suspected or were positive COVID from those who weren't. And we very quickly got to know this as blue and yellow. And so as an estates team and the capital team, we had to suddenly start creating new corridors within existing structures. And in places like wards where there'd previously been sort of open ward and bay areas, we actually had to very quickly put up doors and enclosures and walls to ensure that they were segregated and safe. And also on our sites, we've got a number of different sort of access points where members of the public and staff can come on site. It's a very complex site, and even though the others are not as complex as Doncaster, there are still lots of entrances and exits, so we actually had to lock those down, a lot of them, so that we could ensure that those that were coming on site should be on site, and that when they came on site they washed their hands and decontaminated. So on that point we also installed lots of new sinks around the place. So there was a very sort of physical difference quite quickly in terms of the impact of COVID on the hospitals, and our team were responsible for making that happen. In terms of our biggest challenges and how we look to overcome them, it's really difficult to kind of pinpoint just one or even two because there were so many, and it was a very live environment where the unforeseen problems were just coming at you felt like from all areas. But I think in order to pinpoint them, it would have to be the issues over oxygen and the ability to supply sufficient oxygen to patients that needed it. So it was already an issue that we'd identified as an organisation prior to COVID. Ideally, any hospital has 2 large storage cylinders, which are called VIEs, and that stands for vacuum insulated evaporator. And you just see them as you're driving around a hospital site, a great big oxygen cylinder. And you really do need 2. You need 2 for capacity, and you need 2 in order to have contingency and backup. And certainly at the Doncaster site, which was most predominantly affected by our COVID patients, certainly during the first wave, there is only one VIE, or there was only one VIE. So that was our major concern, that as the patient numbers were rising and the oxygen usage was increasing, we didn't really know how many patients we could supply oxygen to on the site at that time. The close monitoring of the oxygen was not something that we ever did on a daily basis, other than we had a system where if the oxygen got to a point where it needed refilling, the provider, the supplier, would automatically know that and come and fill it up. We'd never monitored it in terms of the use for patients and their consumption. And there's added complexity to that. So even though you may have however many thousand litres of oxygen on site, the pipe size into the buildings limits how many patients there can actually be in a certain area receiving that oxygen. So you may have all sorts of capacity in the actual cylinder in the VIE, but if you've got too many patients on oxygen in your ITU, your intensive care unit, the oxygen can't get up there. So one of our biggest challenges was not only monitoring the consumption of that oxygen when it had never really been done before, but it was if it did get to a critical point, the idea we would have to start decanting patients to other physical parts of the site in order to have the oxygen supply going through the pipes to get to them. So that was I would say, our most challenging issue. Moving on from how I've just described our challenges, some of the key innovations that we actually were able to establish during this, and some of the learning, was we actually managed to implement a system where we could monitor oxygen on not just a daily basis, but a minute by minute, hour by hour basis. And this was done by our own on-site team, working with our IT department, working with pharmacy, working with our physiotherapy, so a completely joint effort, multidisciplinary. The ability to be able to do that meant that several times a day, clinicians would review which patients were in which area, relating to my previous point around the oxygen pipe size, which patients were in which area and how sick they were. Because how sick they are is how much oxygen they may be consuming. So the sicker you are, the more oxygen you need. So we got to a point of only ever monitoring oxygen when we needed a delivery, to actually saying that patient's deteriorating, so we need to consider how many deteriorating patients we have in this area of a ward or on this ward. Now that level of sophisticated information was vital during COVID for all hospitals, especially vital for this because I say we only had the one storage cylinder, the one VIE. And we'd been undertaking this sort of monitoring for quite a period of time during the initial wave that we experienced from March. And we then shared that learning with colleagues who hadn't been quite as concerned about their oxygen consumption because potentially they were in a better position than to begin with. But then as the second wave occurred, even trusts with 2 VIEs and significantly more oxygen than us started experiencing problems because they hadn't been monitoring and they hadn't been doing that intelligent, where should we put patients and get that oxygen to them through the pipe work. The ability to do that actually put us in a position where we may have been a site with only 1 VIE and less oxygen available, but we were one of the sites that didn't go into major incident crisis during the second wave, and we then assisted other trusts that did. It was an extremely valuable exercise in terms of maintaining the safety of our patients at this site, and then became, I'm sure it would have happened anyway, but nationally trusts were then more closely monitoring their oxygen as they started trying to avoid falling over. We did improve the way we worked. We improved the way we worked with partners. So, for example, when we were very worried about the levels of staffing, we contacted the local authority, so DMBC, and talked to them about if you've got staff that are not able to go to schools because the schools were closed, then can they come and work here because we're kind of potentially at crisis point. So there were some, and it wasn't just with DMBC, we spoke to commercial partners. Things that you would have never expected to ever be discussing with anyone. I was having conversations with the national buyers and executives at Morrison's, for example, to say our staff can't get food because there are queues at the supermarkets, and when you get there, the shelves are empty. Potentially, when there is something there, there's limits of how many items you can get. Our staff are working shifts, are exhausted. Can we get essential supplies to our site? And we had very serious conversations about setting up a supermarket just for well, not even a supermarket, a supply store just for staff in our restaurant, so that essential supplies like pasta, rice, potatoes, protein, dairy, nappies, all those supplies could be here for staff and be provided so that they could leave from this hospital environment where they've been working very, very hard in a very stressful situation with the supplies to at least go and sort of go home, decontaminate and try and relax a little bit with their family. So certainly I think working in partnership with people who we would normally work with but in a different way, like DMBC, and then organisations that are private that we would never expected to have worked with. We also had wonderful approaches from the private sector to support. Everybody was just so open to it. And at one point we had a sponsor pay for a big yellow bus that was a food retailer that arrived, and it sat at our main entrance, and it was there serving food to our weary staff. and it was incredibly popular, and staff really benefited from the fact that they could come out of the building, queue up, they played a little bit of music, they even had some live music there once, and staff were able to benefit from a free meal, and also just something to lighten the load during that day. Yeah, there were some real positives to come out of it. So in terms of moving forward, I would always know that in terms of resilience, should, heaven forbid, there'd be anything as serious in nature as this, we do have relationships with partners to call upon that are just so willing to help us. I think that was what was extraordinary, the willingness to assist. And I think in terms of learning within the organisation, in order to keep delivering the services we deliver, we had to absolutely rely on every member of staff. So it didn't matter whether you were a team leader, whether you were a manager, everyone was a decision maker and everyone was involved in running our services. And in a practical level, we actually widened our senior management team and our senior management team meetings, albeit not physically present in the same room. It was on conference call very initially and then on Teams, but we widened it to a much wider section of our staff group, so that they could understand the decisions that we were making, they could be involved in that, and they could come up with ideas, and that is something that we've taken forward. So we are about to recommence a wider senior management team meeting, because the benefits of having everybody else's sort of ideas and thoughts and inspiration is obvious, but it also gives people the opportunity to develop and be exposed to sort of senior leaders and decision makers. So that's definitely something that I would say is a benefit that we've taken forward. One of the biggest challenges was maintaining normal service delivery on site. And to do that, we did have to make some investments. There were some practical things we did, such as we very quickly went to 7-day working, all of us, and started doing 12-hour shifts. I'm not suggesting we were all here for 12 hours a day, 7 days a week, but we entered a shift pattern that we wouldn't normally be in. We'd normally be doing sort of Monday to Friday. So we did that so there was presence on site. So certainly going back to one of the biggest challenges that I discussed, which was that human element of our inability at the time to reassure staff that this was a safe environment and that we weren't sure whether it was or not, but we still expected them to work. It was very important that we were visible. So us being here over 7 days a week and working different shifts, that certainly, I hope, gave them some confidence that we are asking you to be here, but we're also here. So we're not sat working from home, even though that has been requested of us. And by the actual definitions, some of us could have done that. It would have been entirely inappropriate in that situation. It was really important we did that. So that was a very practical step to deliver and maintain services. The contingency was really important, so speaking to partners to have groups of staff who don't normally work in this organisation available should we need them. It was also extremely important to be able to have the adequate cleaning supplies. I talked about estate supplies earlier and our suppliers closing, but cleaning supplies was an obvious, very vital thing, as well as our PPE supplies. So maintaining normal services was absolutely crucial on some what you would normally regard as insignificant things suddenly became really important to be able to actually deliver services. And that's learning going forward as well. You would never expect toilet rolls to be an issue, for example. So certainly that was where we had to change how we worked in order to maintain services. But then there were some investments and physical changes that we had to do as well in order to be able to ensure we had sufficient oxygen to supply to our patients, as well as the minute-to-minute, hour-to-hour monitoring. We also put forward to the National Oxygen Programme that we had to be a priority for a second VIE. That where they were identifying trusts that were at risk, we'd already said we were a risk pre-COVID, so we absolutely had to be prioritised. And we were successful in being supported in that. you couldn't have predicted that there would be a time when the government took over the management of oxygen vessels. But that is exactly what happened. So even though we placed an order for our second VIE vessel prior to COVID, that order then completely vanished because the government controlled all oxygen equipment. So it was great that we were successful and we installed that second VIE before the second wave really hit prior to Christmas. And that hugely reduced the anxiety of all of our clinicians, our physiotherapists, our team on the monitoring side, because not only did we have more knowledge and experience in ways of tracking the consumption of the oxygen, we now had a second supply. So that was sort of really important. And then along similar lines, as the numbers increased of COVID patients, we potentially didn't have sufficient intensive care space for the most poorly. And so we actually built another intensive care unit, and this was in a vacant area on the basement of the main tower block. It was in an area that had been vacated by our surgical sterilisation unit the year before, and in a matter of weeks we transformed that into an intensive care unit. So we knew going into the second wave that we did have not only the ability to increase our bed numbers to be able to care for more patients, but it was actually also on the second VIE, the second oxygen cylinder supply. So that again increased our resilience. I think if I reflect on what I'm most proud of over this period, over the last 12 months, it would have to be the teamwork. And this isn't just a teamwork of my own team within Estates and Facilities, who I have to say just were extraordinary. During those first few weeks, the whole country and the whole world experienced shock. And believe me, we were driving to work on empty motorways, knowing that ideally you'd be staying at home. Yet our team were here and everybody showed up every day. And while we were here, we had to deal with all of the issues and ensure that we delivered the best service we possibly could to keep the patients who were here as safe as possible and give them the best chance possible of recovery. But we used to sort of laugh a little bit about the fact that if you actually listed the COVID symptoms, we all looked and felt as though we had it, because we looked terrible. We just looked appalling. And we were grey, we were exhausted, our eyes were bloodshot, we had terrible headaches, you know, we had sore throats, we had all the sorts of things that you might experience over a prolonged period of intense stress. And so when I talk about teamwork, we supported each other. Everybody supported each other. We made sure we made time for each other if there were concerns. And then outside of Estates and Facilities, there was a genuine Team DBH like never before. And we would meet as an executive team daily, and suddenly people who under normal circumstances may not need to be brought into such a senior meeting on a daily basis, suddenly those people were our lifeline. So you had procurement who are delivering and keeping your stocks of PPE there. They are some of the most important people in the room. Infection prevention and control. These are important things normally, but these were the most important people in the room. For some period, while we were putting up the sort of segregation and trying to create blue and yellow corridors and doing the work we did, and the oxygen, again, some of the first questions asked in those senior meetings is, where are we with oxygen? And so I think for that period, I'll always reflect on it as a time for my team when they felt the most connected to the patient in the bed. Because you could really see that link. And so when I reflect on that last year, I'm most proud of just how great they are and how amazing they did over that period, and how even afterwards, when we expected the fatigue to really set in, I say afterwards, we're kind of still there, but we expected the fatigue to really set in and people to potentially suffer with PTSD, just with stress, which would be perfectly reasonable. Actually, I think we kind of worked through it we're all in it together, we all feel like that, and I feel better when I'm at work and I can talk to people about it. So I'm just immensely proud of not just my team, but the whole organisation. And so I'll always reflect on that year. And I did actually, if he'll forgive me for indulging in this, I did actually write in our Chief Exec's Christmas card, "This has been the most challenging year of my career, but also the most rewarding."